Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been dealing with these intense bursts of light that temporarily blind me, and they're becoming more frequent. It's been affecting every aspect of my life. I can't drive, work is difficult, and it's even impacting my social life. I'm really worried since it seems like we haven't been able to control these episodes effectively, despite the medication adjustments.
I understand your concerns. Can you describe these episodes in a bit more detail for me? How often do they occur, and have you noticed anything that seems to trigger them?
They happen almost daily now. There isn't a clear trigger that I've noticed. It can happen anytime. During these episodes, besides the blindness, I feel very unsteady and shaky, which has led to some embarrassing moments when I'm out. It's like I can't control my body.
That sounds quite challenging. Have these symptoms been present ever since the seizures started, or are they changing over time?
The visual disturbances started around the same time as the other symptoms, but everything has definitely gotten worse over the past few months. The shaking wasn't as bad at the beginning. I've also been experiencing these complex headaches that my previous doctor mentioned could be related. As for the treatments, I feel we've tried a lot, but with limited success. I'm currently on topiramate, which we increased to 200 milligrams. It helped a bit, but these episodes are still a major problem. I'm also concerned about the potential side effects of adding another medication.
It's good that you've had some relief with topiramate, but it's clear we need to explore other options given the frequency of your symptoms. Have you noticed any other side effects or issues with the current medication?
No major side effects from the topiramate itself, but I am taking medication for my prostate, which we had to adjust because it was too effective at first. Thankfully, it doesn't seem to interfere with my seizure condition. Recently, I had an MRI and an EEG. The MRI didn't show anything unusual other than sinus congestion, and the EEG didn't show typical seizure activity, which is confusing. I also saw an ophthalmologist who noted mild cataracts, but nothing that would explain the severe visual symptoms I'm experiencing.
I see. It's good that we have thorough diagnostics done, though it's frustrating not to have clear answers from them. Regarding your cataracts, they are usually gradual and wouldn't likely cause the sudden symptoms you're describing.
Exactly, and that's what's so frustrating. I feel stuck with symptoms that significantly impact my life, and there doesn't seem to be a clear path forward.
I can understand that. It's important for us to manage not only the physical symptoms, but also the impact this is having on your quality of life. Let's review some of the recent lab work and see if there's anything else we need to consider. that might give us more clues.
Thank you, doctor. I just want some relief and to understand what's causing this. I also had a follow-up scheduled after a colonoscopy where they found a polyp and a small ulcer, but that got canceled. I'm worried that something might have been overlooked there as well.
We'll make sure to follow up on all fronts. Let's also keep in close communication with your neurologist. Given the complexity of your case, it might be helpful to consider a multidisciplinary approach if we don't see improvement. Let's look at your recent results to better understand your overall health, and then we can discuss the next steps in more detail. Your blood pressure is 120/78 mmHg, which is good. Heart rate is steady at 78 BPM, and your respiratory rate is normal at 16 breaths per minute. Your temperature is also normal at 98.6 degrees Fahrenheit. Your blood work, including a complete blood count and chemistry panel, is mostly within normal limits. Your kidney function is stable with a creatinine of 1.1 millimillard, and liver function tests are all normal. The lipid profile shows a total cholesterol of 210 milligrams per deciliter, with an LDL of 130 milligrams per deciliter, which we should keep an eye on, but it's not immediately concerning. Given these results and your ongoing symptoms, I suggest we schedule a detailed follow-up with neurology to review your case and consider adjusting your treatment plan. We may need to explore additional diagnostic tests or a second medication for the seizures. We should also reschedule the GI follow-up to discuss the findings from your colonoscopy more thoroughly and address any potential issues there.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I'm really concerned about my diabetes management. Last year, my HbA1c was in a better place at 7.5, but now it's shot up to 8.8. I've been on glipizide since we stopped the metformin because of my kidney issues, but I feel like it's just not enough anymore.
I see. It's important to manage your diabetes effectively, especially with your kidney condition in mind. What changes have you noticed in your diet or lifestyle recently that might have affected your blood sugar levels?
Well, I've tried to be careful with what I eat, but I admit that being indoors more over the winter may have led to less activity and perhaps more snacking. I know I need to get moving more, but my back pain hasn't been helping either.
You mentioned back pain. Can you tell me more about when it's most troublesome for you?
It's mostly when I'm standing for a while or when I'm doing household chores like dishes. It just gets to a point where I have to sit down or lie down to relieve the pain. It's been this way ever since my disc herniation years ago, but it seems to have gotten worse this past year.
And have you been using anything for the pain or tried any physical therapy?
I sometimes take tramadol, which I also have for my heart condition, but I try not to rely on it too much. I haven't gone back to physical therapy recently, though I know it might help.
That's good to keep in mind. How about your sleep apnea treatment? Are you using your CPAP machine consistently?
Yes, I use my CPAP every night. I've noticed it does help a lot with my energy levels during the day, but I sometimes leave it behind on short trips, which I know isn't ideal.
It's good to hear you find it helpful. Consistent use, even on short trips, can make a significant difference. Now, regarding your urinary symptoms and nocturia, has there been any change since starting terazosin?
It's helped a bit with the frequency, but I still find myself getting up at night more than I'd like, which also disrupts my sleep. It's a bit of a cycle with the sleep apnea and needing to use the bathroom.
That sounds challenging. Staying well hydrated during the day, but limiting fluids in the evening can sometimes help with that. Now let's discuss your recent lab results to better understand where things stand. Your blood pressure today is 132/86, which is within our target range given your conditions, and your heart rate is stable at 78 beats per minute. However, your fasting glucose at 162 milligrams per ounce is quite elevated, and this aligns with your increased HbA1c. Your cholesterol levels show LDL at 120 milligrams per, which is slightly above our goal, and your triglycerides are high at 280 mol. This could be contributing to your overall cardiovascular risk. Your kidney function shows some decline with a creatinine of 1.99 millimoles and an eGFR of 33.7, which puts you in stage 3 chronic kidney disease. We need to be cautious with medication dosages and choices because of this. In terms of your heart, your echocardiogram looks stable with an LVEF of 55%, which is reassuring. There's mild cardiomegaly on the chest X-ray, but no active disease. Your CPAP use is likely helping manage the cardiovascular aspects of sleep apnea. Given all this, my plan would be to adjust your diabetes medications, possibly adding a different class that's safe for your kidneys. We should also enhance your regimen for lipid control, given your elevated triglycerides and slightly high LDL. Regular physical activity, as tolerated, will be crucial here, along with dietary adjustments. For your back pain, considering a referral to physical therapy might be beneficial. We also need to address your constipation, perhaps with a mild over-the-counter stool softener or increased dietary fiber. I'd like to see you back in 3 months with a diabetes sugar diary to monitor your glucose control throughout the day. Meanwhile, attending move and nutrition consultation sessions could really help manage your weight and improve your overall metabolic health. Let's also schedule you for follow-up labs in about 8 weeks to see how the adjustments are taking effect. It's important we stay proactive about these issues to manage your complex health needs effectively.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Welcome, everyone. Today, we'll be discussing the legal requirements every healthcare institution must comply with to ensure a safe and secure working environment. First, it's essential to address the Occupational Safety and Health Administration regulations, which mandate hazard communication and bloodborne pathogen standards.
Indeed, and let's not forget about the importance of maintaining patient privacy under the Health Insurance Portability and Accountability Act, commonly known as HIPAA. It's vital that all staff understand the correct procedures for handling patient information to avoid legal repercussions.
Absolutely. And another key point involves the Disabilities Act. This ensures that our workplace is accessible and accommodating to all employees with disabilities. Are there any questions on how these laws apply to your daily roles?
Now look at question 26.
Team, let's quickly go over the key points for today's procedure. We're dealing with a complex cardiac surgery, and the risks include bleeding, infection, and potential complications from anesthesia.
Right, and due to the patient's previous medical history, we need to be extra vigilant about arrhythmias during the operation. We have all necessary resuscitation equipment ready, correct?
Yes, everything's set up. Let's make sure we're all clear on the sign-out protocol afterwards. Keeping communication lines open and clear during the surgery will be crucial for handling any unforeseen events.
Now look at question 27.
Let's consider some non-pharmacological strategies that could benefit our patients with chronic pain. One approach is the use of cognitive behavioral therapy, which helps patients manage pain by changing the way they think and behave.
Great point. We should also discuss the role of physical therapy and exercise, which have been shown to improve mobility and decrease pain intensity. Has anyone integrated these approaches with success in their practice recently?
I have, especially aquatic therapy. It's been quite effective for arthritis patients. What about the use of acupuncture? Any updates on its efficacy?
Now look at question 28.
I want to emphasize how crucial it is for you to come to the emergency department if you experience any signs of a stroke, such as sudden numbness, confusion, trouble speaking, or severe headache. It's essential to act fast.
I understand, but I sometimes worry about overreacting. How do I know it's not just a minor issue?
It's always better to err on the side of caution when it comes to your health. We'd rather you come in and it be nothing than delay and risk severe consequences. Your safety is our top priority.
Now look at question 29.
During radiation therapy, you might notice changes in your skin. It can become red, irritated, or even peel, similar to a sunburn. It's important to avoid any harsh soaps or lotions on the affected area.
I see. Is there anything specific I should use to manage the irritation?
Yes, I recommend using mild, fragrance-free soaps and applying aloe vera gel or a prescribed ointment to soothe the skin. Also, ensure you're protecting the skin from sun exposure by covering up and using sunscreen.
Now look at question 30.
For our patient's discharge plan, we need to ensure all instructions are clear and understood. She doesn't speak English fluently, so it's essential we arrange for a professional medical interpreter.
Agreed, and we should also consider providing all written materials in her native language. Does anyone have contacts with culturally competent care providers in her community?
I will check our database for providers who speak her language and have a good understanding of cultural sensitivities. It's crucial we make her transition as smooth as possible.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Today, we delve into the transformative world of CAR T-cell therapy, a groundbreaking approach in the treatment of hematologic malignancies such as lymphoma, multiple myeloma, and acute lymphoblastic leukemia. Our exploration will not only cover the fundamental aspects of this therapy, but also discuss its expansion into treating other challenging cancers. Firstly, let's discuss the procedure of CAR T-cell therapy. This advanced treatment involves the extraction of T-cells from the patient's blood. These cells are then genetically engineered to express chimeric antigen receptors, or CARs, that specifically target cancer cells. The modified T-cells are expanded in the laboratory and then infused back into the patient, where they seek out and destroy cancer cells. This process requires a high degree of coordination among various medical specialties, including oncology, hematology, and immunology, due to its complexity and the precision required at each step. Patient selection is a critical aspect of the success of CAR T therapy. Ideal candidates are those who not only meet the age criteria, but also have a robust performance status and sufficient organ function. This is because the intensity of the preparatory regimen and the potential severity of the side effects demand that patients have resilient cardiac, pulmonary, hepatic, and renal functions. Speaking of side effects, while CAR T therapy has shown promising efficacy, it comes with its challenges. The most notable side effects include cytokine release syndrome, CRS, and neurotoxicity. CRS occurs when the engineered T cells release large amounts of cytokines into the bloodstream, leading to fever, nausea, headache, rash, and potentially severe cardiovascular and respiratory complications. Neurotoxicity, on the other hand, can manifest as confusion, seizures, or severe headaches. Fortunately, these conditions can be managed with targeted medications such as tocilizumab for CRS and corticosteroids for neurotoxicity. The effectiveness of CAR-T therapy in clinical practice has been remarkable, particularly for conditions where traditional therapies have faltered. For instance, in refractory acute lymphoblastic leukemia, CAR-T therapy has achieved remission rates that far exceed those of conventional treatments. However, the path forward is not without obstacles. The logistics of cell manufacturing, the need for rapid administration in aggressive cancers, and the exploration of CAR-T therapy in solid tumors and acute myeloid leukemia present significant challenges. The manufacturing of CAR-T cells must be performed under stringent conditions with a turnaround time that often is critical for patient survival. Additionally, the exploration of CAR-T therapy's effectiveness in solid tumors is complicated by the tumor microenvironment, which can inhibit the effectiveness of the engineered T cells. To highlight these points, let's consider a case study involving a 58-year-old patient diagnosed with refractory diffuse large B-cell lymphoma. After multiple unsuccessful rounds of chemotherapy and a relapse following an autologous stem cell transplant, the patient was considered for CAR-T therapy. The engineered CAR-T cells specifically targeted the CD19 antigen, a protein expressed on the surface of the tumor cells. Post-infusion, the patient experienced a grade 2 cytokine release syndrome, managed effectively with tocilizumab. Remarkably, within a month, imaging studies showed no evidence of disease, illustrating the potential of CAR therapy to induce sustained remissions even in highly refractory cases. While CAR T-cell therapy represents a significant leap forward in cancer treatment, its successful implementation requires meticulous patient selection, management of side effects, and a well-coordinated medical team. The future of CAR-T therapy not only holds promise for hematologic cancers, but also for a broad spectrum of malignancies, potentially revolutionizing cancer care. As we continue to refine this technology and overcome existing challenges, the scope of CAR-T therapy continues to expand, bringing new hope to patients with few other options.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Good afternoon, everyone, and thank you for joining today's session on a critical topic that intersects the realms of healthcare, genetics, and personal health management. Today, we will be exploring the complexities of personalized medicine, particularly focusing on the implications of genetic profiling in cancer treatments, a field that has seen tremendous advancements in the last few decades. Our discussion will delve into how these innovations are reshaping treatment paradigms and what this means for patients at different stages of their treatment journey. As we dive into the subject, it's imperative to understand the basic premise of personalized medicine. This approach tailors medical treatment to the individual characteristics of each patient. By classifying individuals into subpopulations that differ in their susceptibility to a particular disease, in the biology or prognosis of those diseases they may develop, or in their response to a specific treatment, personalized medicine aims to achieve optimum medical outcomes by helping clinicians decide the specific therapies for individual patients. The convergence of genomics and bioinformatics has fueled the move toward precision medicine, where genetic profiling plays a pivotal role. Let's consider a case study that highlights the impact of genetic profiling on treatment decisions. Consider the case of a patient named Anna, a 38-year-old woman diagnosed with stage 2 breast cancer. Genetic profiling of Anna's tumor revealed the presence of a specific mutation in the BRCA1 gene, as well as overexpression of the HER2 protein. This genetic information is crucial because it not only influences the choice of treatment, but also helps predict the patient's response to specific drugs. For Anna, her oncologist recommended a targeted therapy approach. The presence of HER2 overexpression made her a suitable candidate for trastuzumab, a monoclonal antibody that specifically targets the HER2 protein, effectively stopping the growth of cancer cells that overexpress this protein. Additionally, the BRCA1 mutation suggested that Anna would benefit from PARP inhibitors, a class of drugs that specifically kill cancer cells with this mutation by exploiting their DNA repair weaknesses. The results were promising. Anna underwent a combination of surgery, radiation, and targeted therapy with trastuzumab and a PARP inhibitor. Her treatment was personalized based on her genetic profile, which not only helped in effectively targeting the cancer cells, but also in minimizing the exposure to unnecessary chemotherapy, which wouldn't have been as effective given her specific genetic markers. This case illustrates the potential for personalized treatment plans based on genetic profiling to significantly alter the treatment landscape for cancer patients. However, it also brings to light several challenges. One of the major challenges is the accessibility and affordability of genetic testing and targeted therapies, which are still costly and not available universally. Health insurance coverage varies widely, and not all patients can afford these advanced treatments out of pocket. Moreover, the ethical implications of genetic testing are also a critical consideration. Patients must understand the possible outcomes and implications of knowing their genetic information, which can also impact their family members' lives. Genetic counselors play a vital role in this process, providing education and support to patients and their families, helping them make informed decisions. While personalized medicine and genetic profiling represent a significant advancement in the way we approach the treatment of diseases like cancer, they also bring forth new challenges in terms of ethical considerations, costs, and healthcare equity. As healthcare professionals, we must advocate for broader access to these life-saving technologies and ensure that all patients, regardless of their background, have the opportunity to benefit from personalized care. Thank you for your attention, and I look forward to your questions and a fruitful discussion on this fascinating topic.